Dr. Melissa, thank you so much for being on the Plant Trainers podcast today.
Oh, thank you so much to the both of you. It's been a pleasure. I know that we've been following your journey as well, and I think just to be connected and bring light to the plant-based movement is exciting things to do.
It is exciting, and we're very grateful that you're here with us today. And do you have a moment of gratitude that you want to share with the listeners?
Sure, when you think of gratitude, I don't like to overthink it because you get really grateful for the things on a daily basis. Really, things happen all the time where you appreciate the if it's the breath. I'm all about the breath of just having that relaxation because there's so much craziness in our world, and that simple breath allows me to kind of center myself and allow myself to just let me know I have life. There's other people who are just in the hospital on oxygen, and it's sad. And I see people suffering on through asthma, COPD, but even coronavirus. And so to be able to have that simple breath to remember that this is the breath that calms me down, that centers me, and then also keeps me alive, and it's a gift just being here and having these special moments with each other here on this podcast. So thank you.
It's one of those things that people probably take for granted. They don't realize how, obviously they know how important it is to continue breathing, but they don't really pay attention to that on a regular basis, and how grateful we all should be to be able to take a deep breath and clear our minds and focus on in the moment, which is something that many people don't take advantage of. Yeah.
Yeah, exactly. I feel that a lot of people at least I'm really have an emphasis in mental health. A lot of times you don't take that full breath and we're so tense. We don't realize we're sweating to the point of hyperventilation, and you just create this sympathetic fight or fight moment, and you're just overwhelmed constantly. It becomes such chronic anxiety, chronic fatigue. So when you're just able to, when I remember my breath, I'm just grateful because then when I have that breath, that means I started the day right.
Yeah.
For sure. And I think what I haven't told any of the listeners actually is that I have a book coming out in 2021, and it's all about teaching children. It's a picture book teaching children how to take a
Yes.
big breath. So I think a
Awesome.
lot of us, even though we've been doing it our whole life, we've
Mm,
never really taken the time to learn about deep breaths and thinking about our breath and what that does for the body. And we've had to learn it as adults as a coping mechanism. And the
mm,
whole reason for me writing the book was to teach kids this as part of their life and part of their toolbox from a young age, so that it's just something natural that they do, and they don't have to run their mental health down to learn it, but that they learn it in advance so that they can deal with the stresses that come up in life so much easier.
Yeah, absolutely. And it's so funny that you said it's for kids because that's exactly where it starts. Because I would say that's we as physicians in the ER, and even they get hospitalized for people who literally little kids who they get so anxious or just have a little freak out moment. They hold their breath, they
Mm.
turn blue, and they pass out, and they have seizures. And these little kids start to cope in different ways at a very very young age. And so imagine when you do this into your adolescent years and adult years, it just becomes much worse. So we have an opportunity to, even with our young ones, to really teach them these simple breathing exercises. And I'm excited to hear about that because I've heard about different styles and how to teach little ones how to embrace that and make it fun.
I'm already planning a trip down to your hospital so that I can come into the kids ward and do like a whole like book reading and everything. It's all planned out in my
Oh
head. I'll
my
fill you in on
goodness.
the details after.
Okay, let's do that.
Awesome. So, why don't you tell us a little bit about your journey into plant-based and how you found that?
Sure, absolutely. Um, if we can like backtrack, because I think if when I think about plant-based, that was so foreign to me before. I was not a vegetarian. I was not vegan. I grew up as a carnivore, ate every type of, literally anything with, I say eyeballs, because that's what I tell my patients, because they totally relate. Because I would say in our culture, well, I'm Filipino, and we just enjoy that's in it's in from generations and generations. But then I realized that, there are different types of households where there's also these farmers, right? Not every culture has strictly a heavy plant or a heavy meat eater type of culture. And so I studied psychology, I studied the doctor-patient relationship, and then I also eventually went into medicine. But then I realized that people were just getting sicker and sicker, that there was really no a real long-term solution. I would say. So you give them medications, they go into the hospital because they're maybe not taking their medications appropriately, or they forget to take it, and then they end up getting hospitalized, to the point where it's a stroke or a heart attack. And you think about it, and I ask these patients every day, is like, how did you know that you're getting sicker? Did you know what caused it? And literally no one really has an answer. Maybe they'll say maybe it's a high blood pressure, maybe stress, but no one can pinpoint to diet. And I was searching for that myself. I was searching for that during my undergraduate and medical training, and as I really knew that I was getting sick, the people were getting sick just by these processed salty foods. Like I can see people just gain weight, get high blood pressure at young ages, high cholesterol, and it wasn't really working to say that just medication was the answer, and that we needed to start earlier. We had to prevent and find out the root cause of health. And so when I did that, I got invited at Loma Linda, and that was one of the blue zones over there. And I didn't realize that over there that, okay, they have this more plant predominant lifestyle. And I went to the American College of Lifestyle Medicine, and I saw, you probably all know all these keynote speakers and trailblazers in medicine with Dr. Esselstyn and Dr. Neil Bernard and Gregor, all these people who've dedicated their whole life to nutritional research, and to see how the evidence, because I was searching, I think everyone becomes a little skeptical in the beginning of things, and you're wondering, does this make sense? Do people really get better? But the more I searched and the more I tried it for myself, I became someone who really wanted to implement it. So the first week, I literally was given that immersion experience. You go to conferences and literally you're like, where's the meat? And then you're searching, you're hungry, you're like, this tastes different. But then you realize, wow, I feel so much better. I feel less bloating. I'm not constipated. I have more energy. And that really helped my own journey, because I myself had IBS too, and my mood issues, anxiety, just that gut-brain axis was all distorted. My own dysbiosis, where my gut lacked the fiber, and so I was really pleased to see literally instant results. To me, it felt good. I can go about my day, and so when I was able to implement that into my life, and that's when I said I gotta change. I gotta have a makeover of my kitchen and my pantry, and I'm telling my husband Micah to also do the same, because we need to live. We want to live a quality life and really be as symptom free as possible.
It's interesting that you say you had IBS and then you went to a plant-based diet and it got better, when there are so many people with IBS and their doctors are telling them to avoid all of the fiber because that's going to cause more irritation. And that's pretty much the opposite of what people should be doing.
Yeah, it's so funny. Day in and day out, I have patients who have IBS and they're trying the low-fat MAP diet, they're trying the keto diet, they're trying even the SIBO, Crohn's, all these diets for their IBS, and without even a clear diagnosis. And I think that's always the first step. IBS is a diagnosis of exclusion. So you have to make sure that you don't have celiac disease. You have to make sure you don't have inflammatory bowel disease, which can be horrible because you're dealing with Crohn's and ulcerative colitis, because that can not only lead to inflammation and more risk for cancer and joint pain and even a lost colon. So we definitely have a lot of work to kind of eliminate in the beginning, but most of the time we call it functional abdominal pain, which is also a category of irritable bowel syndrome. And there's both the diarrhea and the constipation in that category, or the mixed, I would say, symptoms. And so we really have to, I would say, people go see their doctors over and over, and sometimes they get the whole $1 million workup, but the root cause, once again, is because probably they either lacked on the plant-based nutrition, the fiber, the quality foods, and even a better sense of mental health and exercise. So there's all of this is multifactorial, but the answer is still the same, right? So like if it's irritable bowel syndrome, if it's SIBO, if it's ulcerative colitis, inflammatory bowel disease, even you name all these chronic diseases, they can be helped so much by a plant-based nutrition.
I was talking to somebody this morning who was telling me that to lose weight, there's no name for the diet, but she's not having any lentils, no beans, very high animal protein. She's allowed all the green vegetables she wants, but no colored vegetables, and very limited grains. So some Ezekiel bread and maybe some gluten-free bread and maybe the occasional potato, and that this is what's helping her to lose weight. And we talked a lot about needing all of these different fibers and how inflammatory the animal products that she's eating are, and how long term that can really play havoc on the body. And then what will happen is she'll go to incorporate some of these foods back in, and she'll find that tolerating them is going to be difficult because the body's not going to be able to process it. It doesn't remember how to process it properly, and it needs to work its way back up. And it's just, and I worry about people's mental health when they are giving up so many of these colorful vegetables, when they're giving up so many of the starches, so many of the grains, because this is food that our cells need, that our body needs. And I know that when I don't eat enough grains throughout the day, or potatoes or quinoa or something of that variety, that I feel almost hypoglycemic, I feel shaky, I feel nervous, and all of my mental health symptoms from before start to become present again, and I can't deal with stress anymore. So I get so worried for people when I hear about them. And we are going to talk about mental health today. And you brought up, I don't know if you want to get into it, but you brought up mood, your mood, and how your mood changed. Do you want to talk a little bit more about that?
Yeah, sure. I think this is where I really connect with my patients, because, mood is so important, because these are the signs of our brain, our gut, our body, just giving those red flags and caution signs. Because if we're not feeling energetic, if we're feeling down, if we're feeling hopeless, overwhelmed, we got to know that sometimes it's because we're lacking a nutrient. And these nutrients are vital. We have essential amino acids like tryptophan and tyrosine, and those are literally found in beans, nuts, and grains, vegetables, plants, all you name it. And when we're restricting our diet, you're really not able to get all that diversity in your food, but also in your guts. And so I always like to go back to the science, and we call this the brain-derived neurotrophic factor, and that's basically in our nerve cells. So that's in our brain and our spinal cord and all our peripheral nerves that go everywhere, and that basically helps maintain the health of our nerves, but also the production of serotonin. And so we need to make sure that we have foods that actually build that up and make it strong. We think of our I would say our gut-brain axis, which is great because 90% of our serotonin is in our gut, and about 60% of dopamine is also in our gut. But we also have to think about the whole system in itself. So there's the immune system, which is also throughout the entire body, especially in the gut with the Peyer's patches. There's the neuroendocrine, so we have those nerves, those neurotransmitters that also elicit the other hormones that I already mentioned. And there's many more. I can go in deep science, but I don't want to bore you too much. But and then these all together, I would say you're able to they all interact. So I know that with the mood, we have to know that if we're feeling symptoms, we have to pay attention to why. Sometimes it is pure nutrition, sometimes it's pure exercise, or sometimes it's pure stress. But most of the time, it's all connected, and we need to identify it. So when you say, "Tell me about your mood," and I would say the processed foods is the foods that you got to minimize first, or even eliminate, because there's this study that they had back in in Canada, that's where you're at, back in 2017, the Canadian process scale, they realized that there's not just the whole foods, but the processed, but the ultra super processed foods. And these super processed foods are what Americans and the whole world even are eating, up to 50% of it. And that's like Cheerios and Fruit Loops and things with so many additives, with MSG, extra salt, natural flavor. And, you see in the back of the label, there's like 30 things on it you can't really recognize. And so those are the things that really inflame us. And then when people are deprived of nutrients, there's actually a study when they were deprived of nutrients. This was back in the 1950s. They actually saw that people ended up getting more depression, anxiety, hysteria, irritability, lack of concentration. And so there are true relationships between food and your mental health.
So when we're talking about mental health here, are we talking about a certain type of mental health? Like, is there a difference if we're talking about depression versus just anxiety or stress or just
a moody tootie?
Moody change? Like, is there a difference?
Yeah, sure. It's funny because you think that women are more in tune with their mood, and I would say I've gotten all patients, men, women, young, old, right? And mental health is such a broad, it's more of a layman's term, but when in the medical world we say depression, anxiety, bipolar, schizophrenia, we talk about premenopausal syndrome, we talk about postmenopausal syndrome, and at all ages there's like different terms. So I would say in the psychiatric world, that's what I'm actually doing an extra fellowship on. At the end of the year I'll be done, so that there is very specific diagnosis, but then, for example, sometimes I would say 75% of people don't actually get diagnosed with their chronic mental health disorder, and it's actually within the primary care office where they get that experience to actually say that they have a mental health condition. But a lot of people don't. Unfortunately, we think it's maybe how we're raised, or maybe there's a stigma, or we think it's maybe we're just we can't even pinpoint the diagnosis in most of patients I've come across, that they just think that this is their normal, but they don't realize that they're actually sick.
I think that we just say, this is part of my life. I get moody once a month, or I can't deal with the stress. It's just part of me. And until we do something, which might seem drastic, like change our diet completely, and then all of a sudden things are more regulated, or the peaks aren't as high, or the frequency isn't as there as much, we realize that we didn't have to settle with ourselves. Mm-hmm. Yeah, we're not willing to settle with partners. We're not willing to settle with jobs, but somehow we're willing to settle with illnesses that we have that we don't even recognize as illness, that we can overcome, but we've never been taught how.
Yeah, exactly. And I think that's part of it is we're not taught how, either in our social circle, or even in the medical office, when things are rushed all the time, unfortunately. And so you're not able to get that experience where someone can take the time to reflect and understand. But also for us ourselves as humans, we kind of block that off. It's our defense mechanism. We're in that denial stage, and that's how we cope. We push it far away, or we dump it in the trash, and then until it rises and takes over, and it manifests as high blood pressure. So I have patients who are on sometimes the best diet, plant-based diet, but they're so stressed that they're on 4 hypertensive medications, and they can't control, or in the fact that they can't cope in a much healthier way, so they end up getting just really high blood pressure. And then other times people don't realize, wow, this high my mental health, I'm seeing people in their 20s and 30s get strokes because they had they have a good BMI, meaning they're not overweight or obese, but they've had their stress is so high that their blood pressure just skyrockets, and they end up getting a stroke. So those are the things that really you can see in the in the hospital setting. So it's sad, but there's also a way. That's why we're here, right? To show people and teach people how to get over these humps.
So if somebody is diagnosed with stress, anxiety, depression, bipolar, is there different foods that they should be eating depending on that diagnosis, or is it the same plant-based diet rich in all vitamins and minerals kind of thing?
Sure, maybe we can step back a little bit because I would say the when it comes to having a healthy gut and a healthy brain, you want to essentially we talk about like the phytonutrients that kind of treats everything, but also for specifically when we talk about if you don't mind, I like to mention just a few studies. For example, blueberries. Can't go wrong with blueberries, but it's flavonoid rich. So flavonoids are very key for just brain health in general, and your mood and your mental health, all those things. And so basically, they've basically showed that the more blueberries you have, it activates your hippocampus, which is supposed to activate your brain, right? So your B, D, and F, and that's really shown to have lower rates of depression. And another one is people will love this is the cocoa, but I'm talking about pure cocoa without milk, right? No dairy in there, but just pure cocoa. When you put that. That's also known to actually help. It has antioxidant properties, but specifically activates the B, D, and F. So that's a really fun one. And then definitely omega-3s. We need that to stimulate and normalize the B, D, and F levels. And then soy. So actually, people forget that soy is not only just good for other things, but specifically with the phytoestrogens, they've actually shown this is more in rats, but that they will have increased levels of that BDNF. And so I really like to look at that. And then one thing is that with folic acid, so folic acid, all the B vitamins, B1, B2, B6, B12, all of those, you want to look at where they come from. So of course we think, okay, there's leafy greens, there's the flax seeds and the chia seeds. That's kind of all where they're kind of mixed into. But I would say if you want very specific things, other than the fiber, you want to look at the sulfurin and basically like broccoli and cauliflower that is shown to increase your mood. When it comes to depression versus anxiety, there's not that many studies in anxiety because anxiety is actually very hard to solely, I would say, treat by just nutrition. It can boost it a lot, but then you need the exercise, you need quality sleep, you need be able to have if it's meditation or some type of relaxation. But depression in itself, there are a lot of random control studies that you can pinpoint and say, okay, well, you know what? I can benefit from curcumin. Those are one. Vitamin B, folic acid. There's a ton of those. Magnesium specifically too. You would there's an interesting study that both magnesium and zinc, they were actually found to be low in those who had depression. And so I'm always reminding my patients, magnesium is not just good for muscle aches, but it's also good for your brain health. And so we want to make sure that is preventative too. You want to have enough magnesium so you don't have a high risk for depression. And then zinc as well. Zinc, you always want to be careful of. Some people overdo their zinc, but if you eat zinc-based plant-based foods, you'll be okay. But I'm not about always over supplementation. But if there is a deficiency, then we can do supplements for a short period of time.
So, what kind of foods should people be eating to get enough zinc and enough magnesium?
Sure. So zinc I just did a fun post there, but basically it's going to be any type of seed. So the seeds like chia seeds, flax seeds, sesame seeds, all three of those are my day-to-day because all of those also have tryptophan and tyrosine. So those are the ones that gets converted to serotonin and dopamine as well.
Is it important to have all three daily or can you rotate?
Good question. You can rotate but I would like, for example, if you look at flax seeds, if you do 2 tablespoons of that, that also lowers your blood pressure equivalent to a high blood pressure medication. So, it's very hard to like pinpoint like one versus because it's a package, right? And some of these plants are amazing in itself. So if you're I say, there's no danger in adding those three together. But if you want to rotate, why not too? And then the second thing is beans. So beans have a lot of zinc and magnesium. So together you would have, always, I say beans, greens, and seeds with every meal, if possible.
So then you'd have a soy milk smoothie with blueberries and cocoa for breakfast. And then
I
you
love
would
it.
have your cruciferous vegetables, so your broccoli and your cauliflower with seeds on top, and you could have with some so you would put your
Tahini.
tahini on top
Yeah.
to cover your
Yeah.
seeds, and then you have your beans and potato for dinner. Yeah.
Yeah, exactly. So simple, but it does wonders.
Yeah. There
It's
we
funny
go.
how simple it is, but so many people try to overcomplicate it and are afraid to go into it because, no, it can't be true. My medication's so much easier to deal with than making all this food,
Right. And
And
I think we feel like we need to get fancy. So normally in July, the kids are away at sleepover camp and Adam's away in Europe and I'm home alone. So what do? I boil up potatoes, I boil up lentils, I steam some vegetables, and I make like for two meals a day, and I make like big salads, and I make for 2 meals a day for like 4 meals at a time these Tupperwares in the fridge, and I'm literally just pulling it out, and some days I put lemon juice on it, and some days I put mustard, and some days I put soy sauce. So I'm changing up the sauce, but I'm eating the exact same foods, and I know that these are foods that I need and that are good. But then when the whole family comes home, I go, oh no, there's a family here, so it needs to be fancier, it needs to be more complicated, and that's when people start to get tripped up.
yeah.
Yeah, and it's funny because it's when we when you go out wherever we need to be is I always say just make sure you're always prepared as much as possible and just enjoy whatever comes your way. We got to be self-compassionate, we got to be prepared, but also we just gotta be in a point of okay, well, this is not the end of the world if you have those like literally some people get really obsessed, and when they cheat they just have so much guilt and their stress picks up and then they start having IBS again and
Yeah.
it's a fine balance. It's I would say it's like the ocean. It's you have these waves that you just overcome, and then little by little you'll get on that surfboard and you'll be comfortable and you'll stand up when needed, and then sometimes they'll take you down, but then where your home base is and you can get back up. So
Yeah.
I
It does make people feel anxious, and then they'll say to me, well, what do you do when you go to a restaurant? And I'm like, well, I order well, what if it comes with oil? I'm like, then I have the oil. And they're like, oh, and then they feel better about their ups and downs because they know that we do it too, right? And you do the best that you can in the circumstances that you can. And sometimes you go out for dinner and you just want it easy, or you go to your mother's house for dinner and so she's left out all the animal products but she's put in all the processed products. Well, it's a meal, and you put in the effort and you go back to whatever you want to go back to the next day. But it gives you an opportunity to check in with your body also, and how do you feel the next day, and are you all swollen, and are you achy, and is your mood not the same? And that reminds you not to eat like that on a daily basis, and to put in a little bit more effort.
Yeah, exactly. It's a learned behavior. When you feel good, you're going to do more of the things that feel good. And in the other ones, if you make so you not feel so good, you probably realize, wow, that was probably because of that hidden cheese or that excess oil. And so yes, it's definitely learned behavior with your palate, your microbiome, your brain. It all talks to each other. So that's the beauty of it being a journey. You just keep going, keep riding the waves of life, and you get through, and you realize, hey, that's what happened to Mike and I. We realized, wow, that just in months we eliminated everything. And so that was awesome.
We talk about the power of food quite often and how what we consume can either hurt us or heal us. And I'm wondering, when we're talking specifically about mental health, are there certain foods that people should be avoiding that are actually causing a lot of harm to their mental state?
Yeah, absolutely. So I briefly mentioned it before, but we can go dive in deeper, because we really, really need to eliminate those processed foods, because literally the MSG, the additives, these things are really so they act on the nerve. So for example, there's good healthy foods like phytonutrients that build things up in your nerves, but there's those things that like MSG and additives that start destroying your nerves and inflame your nerves, and then that's when you end up getting brain fog. That's what they say, brain fog, but really brain fog is like the early stages of depression, anxiety, bipolar, and schizophrenia. And so and then when you add, for example, if you had not just a bad day, but when you had some type of trauma or some type of really, I would say, a stressful event, it just knocks it over. And some of these things are unpredictable, right? We can't avoid the fact that we get sometimes a car accident or something horrible happens and you're grieving because there's a death in the family. But if you already have an inflamed brain, you're going to have a stressor, and it's going to take you into sometimes a deeper depression. And that's when, okay, we have to get those medications ready to stabilize the brain. But that's going to take some time. And then of course you have the lifestyle factors that can really help and maybe have a longer acute stage, but it's hard because there's so much damage that's already been done. And then when you add these multiple stressors, then that's going to be so some patients are on or depression and anxiety medications for lifelong. Sometimes we can help reverse them and get them off medications through strict lifestyle interventions, but other times they have such a hard time because their brain was so inflamed over time. So I say not just early intervention, but also really paying attention to the foods. And so I know I have to stick to your question, and Mike is like, you gotta answer my question right to the point, but let me get to the point here. And so also you want to reduce also the simple carbohydrates, so simple carbohydrates in processed foods, caffeine. So I know people are like really, it's kind of a soft spot that we kind of don't like to talk about because people are addicted, and that's what food is. People get addicted to certain foods, to certain, I would say, processed foods, substances. So I deal with people who have tobacco, alcohol, abuse, and dependence. And so with caffeine, there's actually been a study that if you eliminate caffeine 3 to 4 weeks, it helps decrease anxiety. So you get a little bit of the withdrawal, but switching to green tea is okay. And there's a substance called theanine. So if you look in your non-caffeinated drinks, look for theanine, and that's a calming amino acid. So that's actually much better. And even if you have decaf coffee, unfortunately, there's still caffeine in it. But really, I have patients who literally have migraines and chest pain because they are having too much caffeine. And people think caffeine, like, well, I don't have 5 shots or 5 cups, but I'm just talking about 1 or 2 a day. That's it. And over time, in years, they end up getting these symptoms, and I help them kind of with eliminate or substitute it with something else, and really their anxiety, their migraines, and their chest pain goes away. And so yeah, that's one. Another one is decreasing, of course, sucrose really helps. And so sorry, were you going to say something? You had a facial reaction there.
Go ahead.
Oh, yeah. And then and there's another thing called, so we call it AA in medicine, but it's arachidonic acid, and that's really in your meat. So meat, all forms of meat, so the chicken, the beef, the pork, the seafood, those are the ones. People who have more of that intake they have more susceptibility to mood disorders, and that's been seen in study after study. And so I always say, if you can eliminate your processed foods, your meat products, and then even the dairy. So dairy is big. That also is found where we have high amounts of arachidonic acid, TMAO, that also stimulates the cycle of inflammation. So dairy, animal products, processed foods, and even those stimulating foods like sugar, MSG, caffeine, all of those. And then there's also studies of alcohol. I did go across that, where people who have high amounts of it, that can really some people self-medicate with alcohol, but also if they're doing it on a daily, I would say even up to 1, 2, 3 drinks a day, that still has an impact on your risk for depression, anxiety, and all these other mental mood disorders.
I just wanted to clarify when you said sugar, because sugar has been put into a category to mean carbohydrates and fruit as well. So can you clarify what kind of sugar you were talking about?
Sure, I know exactly. Like no carb is equal, no sugar is equal, right? And so that's going to be there's sugar found in lovely dates and figs, and even in a fruit. But that's a whole sugar in a very basic terms. But then in the simple terms, fructose and glucose, all those they're found both in the non-plant-based foods, but then when you're processing it, like for example white sugar, and then it just has totally no nutrients, and then you're just spiking, and there goes your mood once again. You feel good, you feel horrible, you feel good, and then you feel even worse. And so that's why I think the hard part is that we have a lot of mixed processed sugary drinks out there, and it's just like, imagine, I love smoothies, you get instant benefits, but then if you're drinking a sugary drink, you're just taking your mental health down to unfortunately a lower level than you probably need to, and then you end up really to the point where you're going to have these higher risks for mood disorder. So I always say pay attention to those and be empowered, because if you have a chance to minimize that, you have a chance to substitute it with something better.
We haven't talked about this yet, but I'm wondering how hydration plays a role in our mental health. People don't drink enough water probably, and are walking around with dry lips, dry mouths. Is that affecting us emotionally, mentally, and I guess our mental health overall?
Yeah, so I don't know about you, but most people drink maybe 1 to 2 glasses of water. That's like I do surveys like this in the hospital, and really we need 2 to 3 liters of water, because our brain itself and our nervous system that's the amount of blood and hydration it needs alone, and right, and that doesn't include our heart, our liver, our kidney, our muscles, our skin, and so I would say at the bare minimal we need 2 to 3 liters of water, because that keeps our brain healthy. It keeps the nerves and the hormones literally alive, because we imagine, I just got plants in the backyard because of COVID, and I'm trying to learn the mixing my soil and the compost and the right fertilizer and all that. But if I'm not watering it in just a day, oh my goodness, it's like a raisin and it's deprived. And imagine if we just don't drink for, we skip a day, but a lot of people drink the bare minimal for days, weeks, years, and they're not being able, there's a reason why, that's why they get more brain fog actually, and so imagine these plants, they literally can die in a day, and then as humans we don't realize we're living on the bare minimum, on a empty tank rather than a full tank.
Yeah, sometimes we feed our plants better, more hydration than we feed ourselves sometimes. And I'll do, I'll do audits with my clients before we begin, and I'll be like, okay, how much are you drinking water? Yes, I'm drinking water. How much? 2 or 3 cups, 2 or 3 liters, 2 or 3 gallons. And it's usually 2 or 3 cups, they have a cup with lunch and they have a cup with dinner, and it's, coffee throughout the day, and hopefully not soft drinks. So people really do need to. And I always say get as much in before your coffee as possible, because if you can get somewhere between half a liter to a liter of water even before you start your day, then you're ahead of the game.
Right, absolutely. And it's those little reminders and habits. And I'm saying, the water you, that's why intermittent fasting also works because you're actually more focused on your water rather than, and then of course, you have your 2 meals a day, but then you're really being intentional. Whenever I feel hungry, let me drink my water. And it's really an intentional decision because then we're actually able to suppress maybe our excessive hunger cues and that helps with weight loss as well.
Dr. Melissa, for people that are watching or listening who want to improve their state of mental health, what would you say would be like the first thing that they should be focusing on to improve that state?
Sure, that's always a hard thing, but thank you for that one item to pick. It's really going to be down to the food. I still say the food because I I say it because I've seen it in my patients. I've seen it in myself, where you're eating just junk food, frozen food, excess salt, sugar, oil. All those things will just put you down instantly. And there's it is equivalent. Your nutrition is equivalent to a pill, and imagine the power of that. And I've been to an anxiety depression recovery program in Northern California, where when I say intensive, it's because over about 2 weeks span that's what they focused on was nutrition. And then people who had severe disease where no medication was working, that really really helped them. And so they were getting hydration, where they were getting proper food. They actually got sunlight, so sunlight helps. They were out in nature. They were walking every day, at least 2 hours a day. They were able to get, of course, some counseling and therapy, but in addition, these very small lifestyles were changes that actually did better than being in a mental hospital, where sometimes they were getting IV or we call it an injection. So there's so much power if you're able to kind of just pull yourself into that. I would say new environment, new lifestyle, you can really get over it.
The power of food, and I love the idea of that recovery system. That's beautiful. Getting sunlight, being out, sleep. I mean, we could take this podcast and pick it out into like 10 other different podcasts that we could sit here.
I was like, I can keep talking
for
all day,
an hour.
but
I know. And we wanted to thank you so much for your time. And I wanted the listeners to know, when you talk about Micah or your husband, that's Dr. Micah, and he was on episode 359 with us of the Plant Trainers podcast. So we're going to link to that in the show notes at planttrainers.com. And I have really, especially as a woman, really been enjoying your Instagram. I'm so happy that I found that. It's empowering, it's specific, it's clear, and I love your take on a lot of the issues that have been going on in the world, and I applaud you for speaking up and supporting. So I wanted you to know that, and I wanted everybody else to know that as well. If people want to follow you or know more about you, where would you like them to go?
Thank you so much. Yes, it's an honor, and I'm very, I would say, easy to contact because Instagram, Facebook, my email, they're all the same. melissamondala.md. My website's also melissamondala.md.com. I have my old branded name was Dr. Lifestyle, and it's not because Mike and I split up. It's more because we have so much to share, and I want people to know that if they had a question specific towards me, that they can talk to me through that avenue. That's what I'm doing. And I'm also at the Institute of Plant-Based Medicine. So it's pretty awesome. We get to have the opportunity to work with different specialists. So there's me, primary care, but there's also cardiology, rheumatology, gastroenterology. We'll have endocrinology. We'll have fertility. So every specialty will be involved in helping people really overcome their specific healthcare needs. And it's awesome. It's national, it's international, it's through telemedicine and in person, and at least in Newport Beach. And we're able to find a way to cater to all in a way where they're not going to maybe a different healthcare system where things maybe doctors don't know and maybe they're confused and maybe not support that. So we're here. We're definitely here for you all to show you that we're first human, second where it works, and then third there's some real issues that are relatable. You don't have to be plant-based to be part of our, I would say, influence or even part of our clinic and be seen. You can start from ground zero, and we're here for you.
Dr. Melissa, amazing information. Thank you so much for sharing your knowledge with us and our audience. We really appreciate you, and thank you for being on the Plant Trainers podcast.
Oh, it's my pleasure. Thank you, Adam and Shoshana. Best of luck to all you do. Thank you.
Thank you.